Hello, my name is Helen Palomino. I'm a licensed clinical social worker and CEO of the Cancer Resource Center of the Desert. And oh boy, I can't get it to present. There we go. And today I want to talk about approaching from the diversity, equity, and inclusion perspective for cancer survivorship and cancer patients overall. I think that's really important, especially with the EMR. It's who we're documenting about, and it's about them for the patient. And so this is our approach. The Cancer Resource Center of the Desert is a small nonprofit organization dedicated to helping cancer patients, and our service is cancer patient navigation. And we serve people diagnosed with cancer living in Imperial County, California since 2006. And so we are not clinic or hospital based, we are independent community organization. We serve men, women, and children diagnosed with cancer anywhere on that cancer continuum, be it initially diagnosed, in the midst of their treatment, non curative palliative cancer treatment, transitioning to hospice, etc. Any cancer, any stage, and at no cost to the patient. Our main, if you want to put in a nutshell, our goal is to remove or mitigate any barriers to their cancer care. We are integrated with our local oncologists. We have 2 medical oncology centers, and we have 1 radiation oncology centers, and they're all outpatient. One of which we are contracted with is El Centro Regional Medical Center. They are an affiliate of University of California, San Diego's Moores Cancer Center, and we're integrated in a multidisciplinary fashion with them, as they do not have medical social workers within their own oncology team. We ourselves are 7 bilingual, bicultural medical social workers specializing in cancer care. And so for us, it's just very important to know this. Um, Geographically and who we serve, we are on the southwest corner of the United States. And you see there a map of California, and those are all the counties. We are located on the southernmost border east of San Diego County. We are in the desert, and to the south of us is Mexico, and the city we are up next to is Mexicali, California, and to the east of us is Arizona, and to the north of us is Palm Desert. It's another county. And the reason that's so important is that we are a population of 182,000 people. And we are also a medically underserved poor community. And so it is very common for our population of our community to access health care, not just in the United States, but in Mexico. It is very, very affordable, accessible to get health care there. The reason there's such a robust amount of health care in Mexico, in Mexicali, Mexicali is the state capital of Baja California, which is a Mexican state just south of us. And there you have 2 medical universities, you've got government, state, and federal department heads, and all kinds of accessibility to generalists, specialists. And in the United States, in my community, private employers offer insurance where the medical provider network is in Mexico. So for us, it's a challenge. It's a protective and a risk factor, but it's a reality. So many times people are getting their primary health care in Mexico, either cash pay or through insurance, and then they are diagnosed with cancer, and then they want their cancer treatment in the United States. We are a different type of health system. And so it's important to know that we help people from that perspective, and that's the nature of the community that we serve. So as a patient navigator, we are medical social workers from that perspective. We work with our impoverished community that has very low literacy and even lower health literacy. And so we get help our people to get enrolled in insurance if they're underinsured or uninsured. We work that very specifically with them. They're very distressed emotionally. And so, what we try to do is simplify and utilizing many forms of communication so they understand this very complex diagnosis that they are facing. Sometimes they're diagnosed in Mexico, sometimes they're diagnosed in the emergency room. Some do get treatment through their primary care physicians, but they don't understand what this means. And what's really important to our approach is to respect what it is that they are wanting and to communicate what is happening and what is not happening. And so by beginning with that patient, identifying what they understand, what their goal is, if I cannot tell you how many times people have stated, if this means I have to stop working, even though they're very ill, I'm not going to have treatment. Who's going to support my family? It is a very high, the culture of the majority of people we help, they are all about their family and supporting them. So what we do is begin to work with them in figuring out ways to get them the financial support they're going to need as they're entering into cancer treatment, type of cancer, explaining to them what next steps need to happen here in the United States. All these people live here in the United States. So all of this is occurring in the context of COVID-19 pandemic. Our area is a hot spot and it has impacted healthcare tremendously. It has impacted our team. And one of my team members is in quarantine right now. She was exposed to a patient who had COVID. So we have implemented all of the protocols for this to be able to interface with our patients because cancer doesn't stop in the space of all of this. So we have creatively been able to adapt and provide the support and maintain their cancer care. So that's what we're probably our strength is in being creative and resilient with our patients. This set of items is part of a larger information that goes out to the community in English and in Spanish, asking if they are facing challenges like emotional crisis due to the cancer diagnosis. Do they understand the treatment? Do they have difficulty communicating with their physician? Are they having bills? What's going on? Our approach to our cancer patients is very much about their experience because they are interfacing a very complex US system. And so we approach very holistically what their needs are. And so we have a very strong network of providers, the Department of Social Services, Social Security, regional, state, federal programs to help these individuals go forward with what their needs are. So how does that tie into survivorship care planning? It is from this difficult, complex context that many people survive.
Helen, you
Yes.
have 1 minute.
Okay. So I briefly, just to let you know that we have participated, we are currently participating in a study with the UC San Diego School of Medicine on creating a survivorship care plan with a reproductive focus. And what we've been able to do is create it in Spanish that is responsive to their cultural and language needs. And this has been very helpful in the way we are able to approach it. As clinicians, as physicians, they should understand the health systems that our particular community are accessing, and it's important. Briefly, this is what our survivorship care plan looks like for fertility concerns. We just had our first fertility patient undergo fertility preservation, and in this decentralized community, we were able to mobilize and coordinate care for this woman so she could ultimately get her treatment, diagnosed in Mexico with triple negative breast cancer, got her fertility preservation, and has begun her chemotherapy treatment. This is the birth control patient guide. It's several pages. This is just so you could know that this is being done in English and in Spanish, and that's where we're at. But to be able to approach people from who they are, where they're at, because this is who all of this beautiful work of EMR work is happening. It's about them and how these beautiful professionals can come together and achieve good work. Thank you.